Hi, this is Ting from Hazelton Physical Therapy, and we are here today to show you a little known treatment technique that may be beneficial for people that have tennis elbow, which is otherwise known as lateral epicondylitis. One of the problems that happens in the body that can mimic tennis elbow is an entrapment of a nerve that we call the radial nerve. And the radial nerve actually runs down your arm, and what happens is it runs through some muscles in your forearm here. And when the muscle gets tight, it can actually pinch on that nerve, causing that nerve to be irritated. And when it gets irritated, it creates a pain that mimics tennis elbow pretty closely. So one way to help move that nerve around is to perform what we call a nerve glide. And we'll demonstrate that today with Tara here. So what we do in the clinic is have people lay flat on the back. And because the nerve runs all the way from the neck down into your fingertips, we need to put that whole nerve on a stretch. So in order to do that, I'm actually going to have Tara come right up to the edge. I'm going to use my leg to help drop her shoulder down, which helps put that nerve on a bit of a stretch. We'll have the arm extended out, and I'm going to use my hand to clench Tara's hand to make a fist, push it down and rotate it all the way to the outside. And from there, we're going to drop the arm down until Tara feels a stretch. And a lot of people who are actively painful probably won't get further than about here. And from there, what we do is oscillate the wrist. And if you can imagine a rope running all the way up there, the rope is kind of like trying to move it forwards and backwards or unpinch that little rope or the radial nerve. Okay, so we usually do sets of 30, 3 or 4 sets depending on how irritated someone is. And it can be very good at helping resolve tennis elbow that would otherwise be pretty stubborn. And Tara, stand up for us. What we'll do now as well is if you can't get to a physical therapist or you want to try some of this at home, you can do it on your own. And all you need to do on your own is to make a fist, turn your wrist down, rotate your arm inwards, and then pull it back until you start feeling some symptoms or some pain in that forearm. Once you feel it, just start oscillating your arm at the wrist forwards and backwards. Once that gets easy, you can extend it as far as you can, and when that gets easy, you just tilt your head to the left, to the opposite side, which will put that nerve on an even more of a stretch. One word of warning, however, is that nerves can get pretty touchy, so when you do decide to do some nerve glides, do them very soft, gently, and do them only 1 or 2 sets of 10 to start with, or nerves can actually get irritated. When they become more irritated, they can actually make the pain worse. Or if you have any questions, don't be afraid to visit your local physical therapist who will